All right, John, thank you. Well, summer is the perfect time to start talking about skin care. Dr. John Bauer, a board-certified plastic surgeon with Texas Tech Physicians of the Permian Basin, got to get all that out, is here with us this morning to talk about what we can be focusing on this summer with our skin care. First of all, we got to talk sunscreens. And I know that there's a lot of questions surrounding what ingredients or SPF or things like that. What are your recommendations?
By the way, thank you for having me, Rebecca. It's a pleasure to be here. The recommendations are to, yes, use it, because that is the very first step in getting a protective layer of sunscreen over your face. So the most important thing is to use it. Second thing is there is a wide range of things, and you know, back in the days it was baby oil and burn yourself in the morning. That is an absolute no-no. 50 or higher. For those that are at risk or have extremely light skin, complete protection can be obtained through the use of zinc and those types of 100% blocking.
Okay, so whenever you see an SPF higher than 50, maybe it's a little too much, or? I
don't think that it would be considered too much. If it's not a complete block like a zinc, then outside of 50 it starts to become redundant and probably doesn't do anything more than a 50.
Or lower. Okay, perfect. Now, when it comes to protecting your skin, what are some other options if you're just outside a lot?
Well, I think most people know that the most important thing is to not have the sun rays hit you directly. So wearing a hat, the sunbrella thing has become more and more popular, though it's hard to convince people always to use that option. But the main thing is to don't damage your skin. So good moisturizers, good cleansing, using a sunscreen, and then trying to limit things that damage your skin, like tobacco and other toxic type substances.
So what are some of the main concerns that you see coming into your office in terms of skin?
Most people come in because they have pigmentary changes. They are noticing red spots in and around the sun-exposed areas, and they are concerned, first of all and foremost, usually, that they might have skin cancer or some version of that. That is easy to take care of. But the most important thing is to reverse some of these changes that can be reversed due to the sun's damage. And that is our goal, usually through some version of a retinol-based Retin-A. I think most people have heard of that.
Yeah. Well, and we have some products up on our table right now, and these are some non-surgical options for people, especially if they are looking to reverse some of that skin damage.
Indeed. And the nice thing about these products, I tend to lean towards Zeo, which is by Zain Obaji, and we are allowed to step up some of the aggressiveness that is allowed. There are some really fantastic over-the-counter products, but if you really want to move towards removing some of that old, thickened outer layer of your skin through the use of these non-surgical options, it's best usually to try to get to your dermatologist or a plastic surgeon like me.
Perfect. All right. Well, thank you so much for being with us this morning and reminding us, put on that sunscreen, no matter what it is.
Indeed.
And if you'd like to be here on Good Day, go ahead and contact us.